In less than half a second, in the time it takes a camera to capture an image, you capture the most important moments of your life. In less than half a second, as fast as an eye blink, you could capture the most important moments of your patient's eye health. In less than half a second, you can get the whole picture. The OptiMap technology images the retina faster and with a wider field of view than ever. OptiMap technology produces images that reveal more pathology, helping you find disease sooner and treat it more effectively. Less than half a second can help you prevent vision loss in your patients, so those important moments never fade from view. Less than half a second, and this proven tool helps you uncover critical information to make more effective clinical decisions, as shown in over 400 peer-reviewed studies. Less than half a second, and you will see the value of OptiMap imaging and diagnosis, treatment planning, and patient engagement. Less than half a second can increase your practice economics. Faster retinal imaging frees you to do more patient-critical activity. The most important moments of your life can be captured in less than half a second. That includes an OptiMap image.
Good evening, India.
Good evening.
Good evening.
Good
Welcome to
evening.
the webinar on Optos Widefield imaging, which we find is a very useful tool even to private practitioners. Joining us on this webinar are two very eminent ophthalmologists. One, we have Dr. Dong-Kyu Lee, who is the director of the First Eye Clinic, Korea. He has two branches. He has 8 ophthalmologists working under him. He does over 3,000 surgeries every year. So he will, along with me, teach you about the usefulness of Widefield Optos in our clinical practice. Dr. Han Chow will be joining us. He's the director of the Eye Clinic and Laser Vision Center. He's over 1,000 patients a year. He's an expert on second laser assisted cataract surgery, LASIK, and PRK. I am Dr. Arumori Varman from Chennai, India. I'm a cataract and refractive surgeon. And we have a practice that sees about 150 patients a day and does about 3,000 surgeries every year. So let us understand how in our practice, we have found the wide field imaging to be very useful, both in having perfect diagnosis, as well as engaging the patients, educating them, and taking our practices to a level that has a greater efficiency and a greater accuracy of treatment and outcomes. So let us start off with the talk presentation of mine, which is how it has helped us, especially with the patient flow in our practice, as well as patient engagement and patient education. So can I ask the team to switch on and get my talk online? Good evening from Chennai, India. I'm Dr. Arulmozhi Varman from Umai Clinic, which is there in Chennai, south of India. For the next 15 minutes, I'll take you through the Optos Widefield imaging system that's been of immense use to us for the last 2 years. We all know that fundus examination is a very, very important part of eye examination. We used to do the direct once upon a time. Now we depend upon the 90D with a slit lamp as well as the indirect. These two have difficulties from the patient's point of view, where you need to have the pupil dilated, and the effects of dilation last for hours together, and that causes a problem for the patient. The procedure itself is a lot of glare, a lot of difficulties for the patient. The fundus photography, the standard ones have been available for a long time, including small pupil photographs and undilated non-mediatic cameras are available. But these have limitations where they do not cover beyond the 30 or 60 degree angle of the retina. Where we need to see the full retina, one does have to do montage. The montage by itself is a difficult proposition, takes a lot of time, needs an experienced person to do it, And even with a montage, it never covers beyond 130 degrees. To get to 200 degrees is very, very difficult. So the disadvantage of conventional fundus photography of many, one, they don't work very well in small pupils, though they do work fairly efficiently. They require frequent changes in the shooting angles, and the field of view depends upon the angle of imaging also. So we need to have a person who is highly experienced, and one needs to change the amount of flash intensity to get a good picture. So this is another issue. With the Optos imaging system, all of these are taken care of, and one suddenly finds that everything is very, very, very useful. It's a unique multi-mode imaging system, and multiple protocols are available depending upon the model of the Optos that you buy. We have the Daytona, which has the basic color photography, the red-free, the choroidal imaging, and the autofluorescence. What is important and what do we get out of the system? We get high-resolution imaging, which is wide field, 200 degrees. Quick acquisition without any dilation. Very simple and easy to use. So one, ease of usage, ease of training the staff or the person who's going to do this acquisition for us. We find that we are able to do this very, very comfortably with even our optometry interns who are here with us for about a few months to get experience with using equipment. Even they are able to pick up very rapidly within half a day, maximum 1 day, how to use this Optos. It's easy on the patient, no fundus, no dilation necessary, very comfortable to the patient, and extremely fast. You would have an odd patient who would need some amount of help to get the focus point in. A simple colored fixation target makes it very, very, very comfortable to the patient and very, very quick. So take you through the difference between the conventional fundus photographs and Optos. Optos takes less than 10 seconds. Most often it's only about 10 seconds. Very, very good images or reasonably good images, even in hazy media. Of course, a larger field of view. Patient cooperation and difficulty to the patient is minimal. Fast image processing is available, and it is immediately, instantly connected over the LAN to any system or any computer that is present in the premises, or even systems not in the premises by Wi-Fi or by internet, where you can send these pictures across terminals, across cell phones. So the usability is very, very high. What is the workflow that we have in Umai Clinic? The patient checks in, goes in for vision refraction IOP, and gets Optos. And by the time the patient comes to the consultation room, the Optos image is there available on the computer for the consultant. And often the pre-diagnosis or the pre-decision is made even before the patient walks into the room. Sometimes, depending on the workflow and the crowd that is waiting and the backup that is occurring in the optometry lane, patients may go first for Optos and then go for refraction, vision, and IOP. So here we have one of our optometry trainees who's with us as an intern, who's been able to learn this process and take very good images in a matter of half a day. The time, as I mentioned earlier, it takes about 10 to 15 seconds maximum. Rapid acquisition, easily performed. We had one doubt when we brought the machine, that positioning for elderly individuals, particularly with neck issues, will be a problem. To our pleasant surprise, even older individuals who've got neck issues find it very easy to focus, and we do get excellent quality images almost 100% of the time. And it's very easy for us to train our staff to become conversant in using it efficiently. So you'll find here, we have an elderly patient who has found it easy for her to focus on her own and get good pictures. There's a patient who needed help. Then you have a mother who's able to help a toddler get a fundus photography picture very, very comfortably, very easily. So this is what is very, very important. It is applicable across all ages and across all types of patients with all difficulties, and we still get excellent photographs every time. What is the role in the ophthalmic OPD? We get high quality images right up to 200 degrees. We can do a montage here and go from aura to aura, and we can see the complete retina. serial documentation is possible over a period of time. It's very easy to retrieve the previous photographs taken over a period of months or even years and compare it instantaneously, even when the patient is sitting right across the table. Here we have a well-taken photograph. It's been achieved very easily by our basically trained staff. We do have tools to enhance and sharpen the image post-acquisition. Sometimes you find that the image that has come to the terminal of the consultant may be of suboptimal quality. One need not send the patient back to the Optos and redo the whole procedure. We can use the tools available at the computer terminal and sharpen the image and brighten it. So this image, which is dull and not so bright, has been sharpened at the final terminal by the consultant, brightened up, sharpened, and the image is seen very clearly. All of these protocols are available at the click of a mouse. The same patient, when we need red-free imaging, the whole system can be used to see red-free imaging, see the RNFL, and come to a conclusion as to whether the person has got any glaucomatous changes. Here is another optimization using the tool that is available to go look at the choroidal vasculature. Again, this is all done in a matter of seconds. We have here what appears to be a choroidal osteoma, which was proven to be a choroidal osteoma by doing the imaging of the choroidal vasculature. So the way we find it very, very useful is in patient education and explanation of the disease processes. It is very simple for us at the terminal, the consultant, to show the picture to the patient, the one that he or she has got, the disease process, and at the same time pick up a normal picture from another patient who's there, pick up a normal picture, normal fundus, show the difference, and tell them why that we are asking them to undergo further evaluation and tests. That's very, very, very useful for us. This is something that we find as an invaluable tool to show the patient that this is the normal fundus and this is the glaucomatous cyst that you have. So you would need to undergo further tests such as OCT and field testing to make a diagnosis and treat you appropriately. Is a message that can be carried to the patient very effortlessly and very easily. When we have a picture like this, so the background diabetic retinopathy, where a patient will have probably very, very, normal vision, maybe 6x6, it's sometimes difficult to tell the patient why he or she needs to have an OCT, why the person needs to come back frequently. Sometimes why does the patient need PRP to be done at this stage itself. It's easier with this picture to be shown to the patient so that the patient is educated and further testing and further compliance with the patient is better. So it does help us to explain the need for further tests and further prognosis. We find this invaluable in educating patients and showing them the haziness of the media caused due to cataract and advise them the need to undergo a cataract surgery to get better quality of vision. Often patients with PSC or an immature cataract try to live out with poor quality vision because they feel that the cataract is not affecting their vision. These photographs, as you see here, the haziness that you see is explainable to the patient, though it is minimal and the retinal details are well made out. The patient is now made aware that there is a shadow right in the center, and that is what is causing the glare. And getting the surgery done would help elevate all of these symptoms and make the patient have better quality of vision. We have patients with PSC, small PSC, where the vision will be quite 6x6 or 6x9. But showing the patient this shadow allows us to educate the patient as the presence of cataract and the need for surgery. So what are the advantages of the Optos imaging system? We have improved documentation. We can document progressive lesions and show it to the patient over a period of months or years. It's an invaluable tool in explaining to the patient the condition of the optic nerve and retina. So when you have a patient with background diabetic retinopathy like this, it is useful for us to document this. And when the patient comes back after 6 months or 1 year, to show whether it has got worse, remains the same, and to emphasize to the patient has to undergo further evaluation, and any other treatment such as anti-VEGF injections or PRP can be explained, and the patient can be educated in a way that he or she can understand completely. And glaucoma diagnosis and follow-up is invaluable to us, very, very easy to catch. We can see here the RNFL is smoothened out, while superiorly it is quite normal. When you do a red-free, you can see the complete ironing out of the RNFL here. We can catch that quite early. We can explain to the patient conditions such as these, where there's a splinter hemorrhage, and this is a condition that is seen in early glaucoma, and why this person needs further evaluation, further follow-up, and treatment long-term, easily explained to the patient. So here we have another glaucoma patient with very, very subtle RNFL changes, both superior and inferior, and these can be caught by the consultant and is an important tool in catching early pathologies. Even though the C by D looks quite all right, the RNFL is affected, and this is a condition where we can catch early glaucoma very easily. We do get comprehensive retinal visualization along with peripheral visualization, and here we see a patient with a peripheral retinal hole which can be enlarged and shown to the patient, and the importance of getting laser done for this can be emphasized, and the laser can be done after the patient understands what he or she is going through. We often get patients who have got floaters who complain about the floaters. So seeing the V's ring and showing that this is something that you have in your vitreous, and this is the reason for your floater, it goes a long way in helping us explain the pathology to the patient. Incidentally, this patient had a peripheral retinal hole, and this was enabled us to tell the patient of the retinal hole also and get the laser done. Catching peripheral retinal breaks is really very, very efficient with the Optos system, because we see up to 200 degrees in the periphery and the montage even further. So these kind of lesions which could be otherwise missed are caught very, very easily. These kind of conditions like superior BRVO, optic nerve head drusen, where we can even show the autofluorescence, make the diagnosis, as well as tell the patient what the pathology the patient has got, is very, very useful to us. We also find it very useful after doing a retinal treatment to show, for example, post-PRP, show the patient the picture and explain what has been done, and also explain the need for further lasers sometimes, or for the follow-up that is necessary long-term. Of course, catching retinal detachments is something that we all want to do, and the Optos system works very well in this condition too. So in telemedicine and teleophthalmology, these Optos images can be easily shared across all. We can do a direct transfer on land, or on a web upload. It can go across any distance, and one can share information and get the best diagnosis. Here, pediatric imaging is something we found we find a lot of difficulty in looking at the pediatric fundus. But once we've got the Optos system, we really find that pediatric image is something that's become very easy for us. Here is the photograph here, where the mother was able to get the child into focus and get a beautiful picture done. So this is something that we find very useful in our practice. Pediatric image is something that has been a bugbear, and that's been made very easy. In summarizing, Optos imaging offers wide range of advantages, enhances retinal visualization, early detection is possible, very comfortable to the patient, efficient documentation. It's a versatile tool for patient education and awareness. It's a valuable tool in the field of eye care, contributing to improved patient outcomes, advance of ophthalmic language. In our practice, we found it to be extremely useful. The 2 years that we've been using it, this Optos Daytona has become what I would say as an absolutely essential tool, and has made our practice very efficient and comfortable. Thank you. Can I now ask Dr. Lee and Dr. Lin whether they have any questions or any suggestions or any observations that they would like to make on this presentation?
For optic nerve disease and glaucoma, I prefer the conventional fundus photography. What's your opinion, Dr. Lee?
While they have answered that, can I ask the team? We have a question that comes up. Can you put up the questions, please, so the attendees can go through that and answer it, so we'll know what kind of work the attendees are doing. Can the team put up the question, please? Yeah. Coming back to your Dr. Lee, your question or your observation. This is the question. What typical device do you use for your routine fundus exam? Choose whatever you're using so that we know what is the common practice. Yeah, for optic disease, particularly where we talk about glaucoma, I find the Optos to be very useful because you can enlarge and see it close up. We can actually map out the cup to disc ratio very quite accurately, and it's invaluable in finding out RNFL defects. Invaluable, particularly on the red-free image. So it's very useful to look at optic nerve diseases, and even quite useful in catching early papilledema, and to follow up papilledema, whether it is reducing over a period of time. See, often trying to do serial fundus photographies is quite difficult to the patient. Well, Optos is so easy that if the patient were to come in every other day, you can quite comfortably ask the patient to go through these photographs again and again. And where we expect to see changes in the fundus on a short term, there's no harm or difficulty in asking the patient to go through this process on a repeated basis. That's where I find it to be quite useful to me. Dr. Lin, anything that you would like to say?
I have the same opinion with you. Widefield EBG is very good at show the preoperative and postoperative cataract clearly. My patient also very happy to see their cataract gone on the Optos image.
Yeah.
The same as you.
The basic advantage I find is the ease of usage. Everything stems from there. Of course, the Optos is a fabulous instrument that gives you very crisp and clear images. It gives you a very wide field, but the most important thing is the ease of use and the comfort to the patient. No dilation, takes just about 10 seconds to do. So the patient does not feel any difficulty doing this procedure. So the results showed that most people are using other methodologies, but about 30% are using some form of wide field imaging. Have you, either of you, Dr. Lee or Lin, have any experience with other modalities of wide field imaging other than the Optos?
I have a Aiden confocal photography. I use Aiden and Clarus on inside size. So I preferred Optos imaging. And so wider and quicker.
Quicker.
Yeah, quicker. So easy. User-friendly and patient-friendly.
Exactly.
Yeah.
So that is actually in a nutshell. It's patient-friendly, quick, and wide field. And that makes all the difference. And how do you find, in my practice, we found that the training the person who's taking the photograph was quite easy. That it didn't take time. We could train anybody in less than 1 half-a-day session. Has that been your experience too? Did it take a long time to train the person who was taking the photographs, or was it easy?
Yeah.
I can't hear you.
Yeah.
It was easy. Now our practice, we really found that to be quite easy, that we could train any person in a matter of half a day to become an expert at taking these photographs.
Good evening. This is Donggyul Lee, as introduced earlier. It is my pleasure to be invited to this wonderful webinar. Today, I'd like to share my experience using Optos. My presentation will be as follows: my clinic, introduction to wide field imaging, overview of Optos technology, some case studies, and summarizing the main takeaways. Our clinic is located in South Korea and operates 2 branches in Hwaseong and Suwon City. 8 doctors are currently conducting specialized consultation in their respective fields. We provide a wide range of medical services, including general ophthalmology, laser vision correction, cataract surgery, retinal vitreous surgery, and pediatric ophthalmology. Currently, our clinic are operating 2 Optos Daytona devices. When you take a picture, which picture do you prefer? If you focus on the cool background, you don't know the details. If you zoom into one place, you cannot capture wide view around you. I prefer pictures with a wide background. In general, wide photography means expressing as widely as possible, including the subject on the picture. In particular, ultra-wide photography is a way to create a wide field of view by extremely distorting the perspective of the subject. The actual view of fish eye provides a lot of information at once, like this. In the ophthalmologic field, with conventional fundus photography, you can only take photos of optic disc and posterior. The ETDRS7 field technique requires pupil dilatation. Multiple images must be composited together. Compared to this method, Optos give you the much wider range of information in a short time. Optos offers much wider range of information than conventional methods. To secure a field of view similar to Optos, using a Goldman 3 mirror lens would require examining the eye by moving approximately over 19 times more extensively. Optos was founded in 1992 by Douglas Anders. His son lost all sight due to a retinal detachment. The imaging system aimed to detecting lesion early and to preserve vision. It used a scanning method using a dual frequency laser. The red laser passes to choroid and the green laser to the RP and combined them to create an image. Accordingly, it can help determine the depth and the layer of lesions. Furthermore, by rotating the eye in 4 directions, up, down, left, and right, imaging can be extended to more than 220 degrees, the far periphery. As a principle, we conduct Optos examination for all new patients at my clinic. In particular, the following indications are useful: suspected retinal disease, pediatric and elderly patients, risk of angle closure glaucoma after pupillary dilatation, regular checkups for retinal disease like diabetes, and requiring detailed observation of change after surgery or procedure. Now, I am going to show you some case. This patient visited our clinic for LASIK surgery. In the inferior periphery, exudation, retinal hemorrhage, and vascular telangiectasis were observed. Subsequently, he was referred to a tertiary hospital for further evaluation. A healthy man visited the clinic and conducted an Optos examination without symptoms. In the right eye, a retinal tear was observed in the superior temporal side, and lattice was observed on the inferior side. Barrier laser treatment was performed, and the patient is currently under stable observation. This is a young man who presented with headache and periorbital discomfort. In both eyes, unusual vascular shape were observed. A salmon-colored fundus with involvement of creamy vessels was noted and diagnosed lipemia retinalis. The patient was referred to the internal medicine department, found that total cholesterol containing Tg was higher than 1000 mg per deciliter, so started medical treatment. This is an 18-year-old female patient who complained of suddenly blurry vision in her left eye. On Optos images, small-sized multifocal gray-white spots were observed outside of superior arcade. These spots were predominantly visible in green separation view, indicating a lesion above the RP level. She was diagnosed as Muse. In the first week, the lesions shows a diffuse fusion pattern. However, after 2 months, they showed a self-improving course. This is a 43-year-old woman with a history of long-term medication for rheumatic disease. She presented with a complaint of blurry vision in her left eye. The patient was diagnosed with toxic cataract, accompanied by posterior subcapsular opacity. Due to concerns about losing accommodation at a young age, the cataract surgery was delayed while monitoring the progression. 2 years later, in both eyes, cataract surgery was performed. In this case, Optos imaging helped objectively explain the medial opacity related to the cataract to the patient. This is a 35-year-old male patient who came to my clinic with left eye photo. In the left eye, numerous vitreous opacities were observed, along with old barrier scar in the superior retina. Additionally, multiple yellowish spot was observed in the nasal equator, but I could not find any tear and retinal hole. So I have decided to monitor the progress without any procedure. However, the patient returned 3 days later with worsening symptoms. The vitreous opacity increased further, the small yellow spot became more distinct, and some spots were progressing to the retinal tear. Laser treatment was performed. 3 months later, the small yellow spots appeared. This is a case that shows the progress of creating the retinal tear through PVD. 64-year-old woman. She visited the clinic due to discomfort in the right eye, and no abnormalities were found. However, the discomfort persisted, then she came to my clinic for further evaluation. On Optos imaging, a mass-like lesion was observed in the superior periphery of the right eye. In the choroidal layer, a heterogeneous colored mass Measuring 6 by 6 disc diameter in size was observed. On AF imaging, hyperfluorescence was noted due to lipofuscin accumulation in the RP overlying the melanoma. The patient was referred to tertiary hospital and underwent brachytherapy. This is a 42-year-old man who visited my clinic reporting a clouding vision in his right eye 1 day ago. A large retinal tear and bruised RD was observed in the spherotemporal area. Immediate surgery was performed. On POD1, with a gas full tamponade in place, it was confirmed that barrier laser marking had been effectively performed around the tear. Additionally, the gas level appeared to decrease objectively over time. It can be valuable for post-operative monitoring. It is possible that this patient is one of the individuals who underwent the most frequent Optos examination in my clinic. A 36-year-old healthy man, he had a haze view and red eye 5 days ago, and then diagnosed with anterior uveitis in another clinic. He was only using eye drops, but there was no improvement, so he came to my clinic. On Optos imaging, a numerous spots with white opacification in various sizes were observed on the outside of equator. After diagnosed with acute retinal necrosis, antiviral therapy was started. While starting antiviral therapy, the severity of retinitis was regressing, but simultaneously vitritis and arterial obstruction were progressing, resulting in intensification of immune reactions. 1 month later, large tear and subtotal RD were observed. The patient underwent vitrectomy with silicone oil tamponade. The patient is currently under observation with Optos. The benefit of ultra-wide-field imaging: detecting retinal disease early to prevent vision loss. For the patient, providing the convenience of examinations and assisting in understanding disease through visualization. For the doctor, reducing the likelihood of missing a lesion and objectively recording the progression and treatment of disease. However, limitations: peripheral distortion, not true color, 2D imaging. It cannot completely replace with other retinal examination. In summary, Optos ultra-wide-field imaging is an essential tool not only for retinal practice, but also for all ophthalmology consultations, and providing comfort and happiness for both patient and doctors. So now one of essential in my practice. With that, I'll wrap up my presentation. I hope you found the presentation informative and valuable. Thank you for your attention.
Thank you, Dr. Lee. That was very informative. We did have a whole range of interesting cases that you brought out, where it's helped out you clinically, and also to help the patient understand what exactly the patient was going through. That's where we find this usefulness. Dr. Lin, do you have anything to say about this presentation or any observations?
I think for retinal tear, it's very important to use Optos to follow up the patient, because when patient look further for ataxia, the retinal tear may not be seen at the first time. They will come after 1 week, 2 weeks. So Optos play a very important role in discover the retinal tear. I think this case is very good. Thank you.
Thank you. Can the team put up the next set of questions so that the attendees can answer them? This is, I think, having two images, RPE with a green laser and choroid with a red, with effective for more accurate diagnosis. So let's see what the attendees will have to say. So how often are we relying upon the choroidal vasculature delineation by the Optos? Of course, we rely quite a bit. Oh, yes, the answer says absolutely. Most people, only 25 say probably. So that's nice. Which of the two do we find more useful? The ability to look at the red-free pictures so that we can catch RNFL defects very early. Is that more important and more useful than looking at the choroidal vasculature? Which of the two would either both of you, Dr. Lee and Lin, would you like to comment on that? Which do you use more and which do you find more useful? I personally find the RNFL, the red-free, the most useful because I kind of use it almost in every patient.
Yeah. In my case, in Optos, I prefer lead separation view. Yeah. In viewer, Optos viewer, and I use lead separation imaging is useful for choroidal vasculature.
Okay. Dr. Lin, you have anything to observe on this?
You mean the...
Now, which of the two modalities do you find more useful? The red-free or the choroidal vasculature delineation, the one that...
I think both are important because that's a difference. The autofluorescence see the retinal pigment epithelium dysfunction. And red-free is to see the retina or choroid region. We must combine together to make the accurate diagnosis. Both important, I think.
Okay, thank you. Yeah, I agree. Both are absolutely important, but I tend to use the red-free on probably every single patient and the choroidal vasculature imaging less often. Not that it is any less useful. We just find that looking at the RNFL is kind of paramount importance, so we use it a lot. And also, it also catches very small early bleeds on the retina where you could miss it out. That also is caught very easily on the red-free. Any other observations by Dr. Lee or Dr. Lin? Otherwise, we can go on to the next presentation. The team, can you come up with Dr. Lin's presentation, please?
Good evening, everybody. I'm Dr. Hongzhou Lin from Dr. Lin's Eye Clinic and the Laser Vision Correction Center, Taiwan. Thanks Nikon company for inviting me to talk about how Optos monocle ultra-widefield imaging with OCT widening and improving my field of practice. I have no conflict of interest to declare for my presentation. This is Dr. Lin's Eye Clinic and the Laser Vision Correction Center. I majored in femtosecond laser-assisted cataract surgery and femtolasic and trans-PRK and small incision lenticular extraction refractive surgery. Before monocle, when patients complained of thin floaters, I had to use infrared ophthalmoscope to check if there was anything wrong in the posterior segment a tiresome and time-consuming task. The bright light also is harmful to the eyes of both the patients and doctor. On condition of finding a retinal tear through the infrared ophthalmoscope, I tend to split them by a microscope and contact ophthalmoscope to define and take picture of the retinal tear, and then performing photocoagulation to enclose it. After I bought monocle, patients were advised to take monocle ultra-widefield imaging with central, right, left, superior, and inferior gaze, plus autofluorescence and OCT of posterior retina and optics by the technicians if they had the following indications like pruritus, lightening, glaucoma, diabetes mellitus, blurred vision from suspected posterior segment lesion, and also before and after cataract operations, laser refractive surgery, intravitreal injection, and laser vitreolysis. After finishes the monocle examination, patients were brought into doctor's office to see the results, which was transferred to doctor's monitor through internet. This is a procedure comfortable and fast for patients and doctor. Both doctor and the patients can see the results thoroughly and can compare them with previous results to see the changes. Patients could understand and believe easily what doctor said. Ultra-Widefield imaging could easily detect very peripheral retinal tear and define the margin of retinal detachment, decrease the rate of misdiagnosis, and make follow-up easily and thoroughly for doctor and the patients. On the right is the first visit of a patient's complaint of photopsia. We can see a small retinal hemorrhage on the temporal peripheral retina. On the middle is 17 days later. A retinal tear and retinal detachment developed. On the left is after I perform photocoagulation to enclose the retinal tear and retinal detachments. Ultra-Widefield imaging discovered retinal tear and detachments and make follow-up peripheral retinal lesions simple and reliable, which improved my practice. Optos can provide montage of central, superior, inferior, temporal, and nasal ultra-widefield image to help doctors to see more peripherally, to make accurate staging and follow-up of diabetic retinopathy. A teenager sustained eye injury developed commercial retina revealed by ultra-widefield imaging, was shown here. On the left is the patient's complaint of annoying vitreous floater. I perform yak laser vitreolysis to clear the vitreous floaters. The ultra-widefield imaging helped to find and locate the annoying vitreous floaters complaints by the patients, and it helped to show the effects of laser vitreolysis to the patients. It widened and improved my field of practice to laser vitreolysis. This is the case of branch retinal vein occlusion. On the left, the ultra-widefield imaging revealed the extent of branch retinal vein occlusion, and on the right, the combined OCT shows simultaneously central macular edema of 302 micrometers without bothering to use another OCT instrument and look into different databases. I performed photo calculation to lessen the macular edema to 297 micrometer 9 days later, as shown on the right of the OCT image. Unfortunately, 2 weeks later, the macular edema exacerbated to 424 micrometer, as shown on the OCT image on the right. So I performed intravitreal injection of anti-basal endothelium growth factor. 10 days after the injection, the macular edema subsided to 297 micrometer. Through the help of Monaco Ultra-Widefield imaging plus OCT, I widened and improved my field of practice to treat macular edema from different causes by intravitreal injection. This is the case of proliferative diabetic retinopathy combined by vitreous hemorrhage and neovascularization glaucoma. We can see obvious neovascularization on the nasal arcade. I performed pan-retinal photocoagulation and the intravitreal injection of anti-basal endothelium growth factor to relieve the proliferative diabetinopathy, vitreous hemorrhage, neovascularization glaucoma, which was shown clearly by the ultra-widefield imaging plus OCT. Diabetic macular edema could also be diagnosed at one glance by ultra-field image plus OCT. This is another case of proliferative diabetic retinopathy complicated by proliferative vitreous retinopathy plus vitreous hemorrhage and diabetic macular edema, which also can be diagnosed at one glance. On the bottom, we can see macular traction and diabetic macular edema clearly by the OCT imaging. I performed repeated pan-retinal photocoagulation and intravitreal injection of anti-basal endothelium growth factor, and the vitreous hemorrhage was absorbed and the macular edema subsided. On the right, we can see a macular hole, obviously, and on the left, we can see the macular hole was healed after operation. On the right, the combined OCT could further confirm stages the macular hole, and on the left, it can show the healing after operation. Bilateral exudative age-related macular degeneration was revealed clearly by ultra-widefield image plus autofluorescence and OCT. Central serous choroidal retinopathy was diagnosed readily by combined ultra-widefield image plus OCT as well. This eye had received retinal detachment operation, focal emulsification, and the implantation of intraocular lens, which also sustained macular traction, as shown on the OCT image. This is a patient with poor vision, especially in the night. At the top, the red-green automap look no big difference, but the combined autofluorescence image at the middle revealed retinal pigment epithelium dyspigmentation, and the OCT in the bottom reveals submacular retinal pigment epithelium thickening and edema. On the left is an eye post-penetrating keratoplasty. The red-green optomaps show pale disc and enlarged optic disc cupping. Optic disc OCT of right eye show deep white cupping, and on the bottom, it also shows the thinning of the nerve fiber layer to 61 micrometer. The automated perimetry show visual field defect of the right eye. Thus, the ultra-widefield imaging and OCT help to evaluate the optic disc cupping and nerve fiber layer to monitor the progression of glaucoma. This is a patient of cataract. The slit lamp laparoscopy revealed severe nuclear opacity with posterior polar cataracts of right eye. We performed routine perioperative ultra-widefield imaging plus OCT to exclude combined vitreous or retinal disease for every cataract patient. On the right top, we can see a dense opacity cast by the cataracts, and in the middle, the autofluorescence image was also blurred. And at the bottom, the OCT image was also disturbed. On the left side, we can see post-operative red-green optomap show the central opacity was gone, and the persisting vitreous floater and the temporal retinal degeneration was shown. The montage of central nasal superior inferior and the temporal images show more of the peripheral retina in one image. The autofluorescence images show the dramatic clearing of image after focal emulsification and the intraocular implantation on the left. The superior temporal retinal hole and the enlarged optic disc cupping of that eye, founded by routine postoperative ultra-widefield imaging after LASIK, was noted on the right. The autofluorescence image also revealed the superior temporal retinal hole with ocular ID and enlarged disc cupping of that eye. Moreover, OCT of right eye revealed central macular edema of 311 micrometer. On the right, OCT of left eye revealed the nerve fiber layer thickness of the macula decreased to 83 micrometer, far thinner than 125 meter of right eye. On the left, automated perimetry revealed the typical arcuated scotoma of left eye and confirmed the diagnosis of normal tension glaucoma. Ultra-widefield imaging plus OCT proved itself to be a simple and valuable tool for follow-up of postoperative patients and could discover normal tension glaucoma and retinal plaque to save patients' vision and also protect doctors. Thank you very much for your attention.
Dr. Lin, that was a very nice presentation. It's very impressive that this Monaco, the Optos Monaco, which can do both wide field photography as well as the OCT in about a minute and a half, which makes it quite a useful tool in practice, where you don't have to shift the patient from one instrument to another, saves time, gives quite a good accuracy. So that's something that I have no experience with. Could you let us know how combining both the photography as well, wide field photography, as well as the OCT in one helps your practice?
Uh, uh, Before Monaco, patient had blurred vision. I only can do by indirect ophthalmoscope. And I don't know what happened because the color founders can tell us little about the region. The most of the macular region need OCT to see the true cause of the blurred vision. So OCT is very important in diagnosis of macular disease. So after I bought Monaco, it helped me a lot. Without Monaco, I have to refer my patients to the medical center more often. But after Monaco, about 99% of patients with blurred vision, I can make diagnosis and treat it by myself. And only a little patients need to be referred to medical centers. So it helped me very much. Patient had more confidence in me, and I also had more confidence by myself. I'm very happy. I become a more potent doctor. I think it do me great help.
Thank you. Can the team put up the last set of questions so that the attendees can answer them? And I'll have one question to Dr. Lin. When you compare the OCT pictures that comes off the Monaco, are they as good as one that comes off from a swept source OCT standalone machine that we are all using?
Actually, I bought Monaco is because I want to buy a OCT. So I have tried about 4 type of machine, 4 type OCT to choose one, but I cannot find one OCT which suits my purpose. Some OCT it's very hard to take the image, and some OCT take long time, and some OCT is not automatic. The technician can do the right examination, but Monaco is very easy to use. The technician only have to take about 10 minutes, half an hour, training. Then they can take picture. So it's very easy for the technician to take good image, very easy to use. And the image by the Monaco is very clear. And the depth, the lesion depth is checked, is very accurate. So I think the Monaco not is good at ultra-widefield vision. It's also very good at OCT. It's I think it's better than other OCT. I love it very much.
I understand that because we use other OCTs, swept source. The pictures are very good. We are satisfied with the pictures, but the time taken is quite long, particularly in hazy media or not so cooperative patient. The time taken is quite long. It can be quite taxing to the team, as well as the patient needs to keep his head in that position and tilt and do all kinds of things to get pictures that are off center. So I do agree. I've not used the Monaco, but going by how the Optos works, so that's going to be a gift to our practice. Dr. Lee, do you have anything to add on to that?
I'm operating 2 type Daytona, old version and new version. Old version is have some problem, peripheral distortion, but new type and this problem is much improved.
Thank you. Thank you so much. The team, you have not put up the last set of questions. Do we have any questions that are there for the audience? That's there. Okay. The question is, do you do OCT exam for glaucoma suspect glaucoma patients? So let's see what the answer says before we end the session. Let's see what the answer says. So what about Dr. Lee? Okay, of course, Dr. Lee and Lin. Yes, it says 80% do in most of the cases. 6% say sometimes. 13% do not have an OCT. So we'll wind up with the last question to both Dr. Lin and Lee. How important do you find disc OCT to be in diagnosing and treating glaucoma?
I think OCT is very important because we can see the nerve fiber layer. Because I had found many patients with thick optic cupping, but they have thick nerve fiber layer. It's very strange. So the OCT can tell us if the nerve fiber layer is really thinning. And also I find it's very important for the macula. Because in glaucoma patients, not only the nerve fiber layer of the optic disc is thinning, but also the nerve fiber layer of macula is thinning. So by the Monaco, we can tell, can see if the nerve fiber of macula and the optic disc is thinning, and it can make us very valuable in follow up this patient to see if our medication will work.
Anything, Dr. Lee?
Yeah. After listening the Dr. Lin's webinar presentation, I have interest for Monaco OCT. I wish I meet Monaco in my clinic.
Thank you. Thank you, Nikon-Optos, for this wonderful program. I'm sure it was useful for all the attendees. Thank you, Dr. Lin and Dr. Lee. It was a pleasure that we all got together and we have shared our knowledge and our experience. Thank you so much.
Thank you.
Can you play?
Thank you so much.
Team, can you play the winding up video, please?
Unlike conventional fundus cameras, Optos ultra-widefield devices capture high-resolution 200-degree views, showing 82% of the retina in less than half a second. There are many reasons why Optos ultra-widefield imaging is clinically essential for your diabetic eye care. Here, 6 specialists share some of those reasons.
The International Wide-Field Imaging Study Group defined nomenclature based on anatomic landmarks to enable doctors to consistently describe ultra-widefield and wide-field retinal images. The term ultra-widefield is defined as an image showing the retina anterior to the vortex vein ampulla in all 4 quadrants, whereas wide-field images are centered on the fovea and include retina in all 4 quadrants posterior to and including the vortex vein ampulla. Only Optos technology can produce single capture ultra-widefield images as defined by our study group.
The presence of predominantly peripheral lesions on color ultra-widefield images was associated with an almost 5-fold increased risk in diabetic retinopathy progression over 4 years, independent of baseline severity and hemoglobin A1C. Subsequent larger studies have shown the increased risk is best associated with non-perfusion observed using ultra-widefield fluorescein angiography. These findings demonstrate that detailed peripheral retinal evaluations with ultra-widefield fluorescein angiography provide important information that is necessary to completely assess the risk of diabetic retinopathy progression.
Our products use a proprietary imaging system to capture a high-resolution ultra-widefield image of the retina. Our red and green lasers are scanned about a proprietary mirror system, creating a 2-dimensional scan point in space, or our virtual point. The lasers then scan about the whole of the retina, creating this 200 degrees ultra-widefield optomap in under half a second.
We are facing an increasing number of diabetes patients in all Asian countries. Earlier detection of retinopathy is key. Optos 200-degree ultra-wide-field imaging doesn't miss any earlier sign of retinopathy, which we used to miss with a 45-degree conventional fundus camera. It enables us to provide earlier treatment to the patients, and I would say is the best device for the screening of DR.
The beauty of Optos ultra-wide-field imaging is that it gives us not only color images, but also autofluorescence and angiography images. This allows us to perform quick screening as well as detailed examinations of lesions such as hemorrhages and non-perfusion areas.
I think one of the biggest advantages here is that without having to take multiple images and montaging them, we're able to get wide field fundus imaging in a non-dilated pupil. This is a huge advantage in our practice where we see a large number of patients walking into our outpatient department.
There are many reasons why Optos ultra-wide-field imaging has been well received across the globe. This is supported by more than 2,000 clinical studies. Many practices around the world recognize Optos as the standard of care.